How's it going, guys? We have a medium difficulty question, pharmacology, SIPS 1, 2. In case any of you are wondering, I don't want to make this a hyper long intro right now. The YouTube just jumped from 1205 to 1216. We're starting the process of making a member-only Qbank. We are going to continue everything on YouTube. Don't worry, the daily clip, etc. That's not going to change. All the free content is maintained, okay? But you're going to notice the clips hopping numbers. We're going to build internally at the moment a member-only Qbank. It's not available yet, okay? We'll let it mature. It's to be decided whether it'll be 200, 300, etc. before we launch it for early monthly subscribers. But as we roll that out, we'll let you guys know. But I'm just articulating this because people are going to notice that the YouTube will start hopping numbers, okay? And that's what's going on here. So a 41-year-old woman, 2-day history, blisters on her lips and cheeks, type 1 diabetes mellitus, and she's on insulin and enalapril. Mycoplasma pneumonia a week ago, and it's true with antibiotics, chest x-ray is shown. This is just showing us bilateral interstitial infiltrates, classic for walking pneumonia, okay, and just atypical pneumonias in general, whether it's mycoplasma, Legionella, chlamydia, etc. But it's not relevant to answer the question, but here's your x-ray, cool. What's most likely responsible for the patient's Q presentation? Choice A, 30S inhibitor, correct answer. You need to know that atypical pneumonias, especially mycoplasma, are classically treated with azithromycin, which is a 50S inhibitor, okay? It's not what we used here. Classically used macrolides, such as azithromycin. However, you can also use doxy, all right? And doxy causes photosensitivity. So tetracycline antibiotics, photosensitivity. It's not dramatic, but that's presumably what was given here. And tetracycline antibiotics, such as doxy, can also cause tooth discoloration in children. All right, so those are the two highest yield adverse effects you got to know for tetracyclines. Obviously unrelated, demiclocycline can cause nephrogenic diabetes insipidus, but it's not used as an antibiotic. So 30S inhibitor could also refer to aminoglycosides, such as gentamicin. That'll do nephrotoxicity and ototoxicity. Could do a 40-minute seminar on all of these antibiotics. Wrong fucking answer. Choice B, 50S inhibitor, wrong fucking answer. As I just said, azithromycin and macrolide would be 50S, but wrong in this case because it doesn't cause photosensitivity. Macrolides can prolong the QT interval. I want you to know that. Drugs that prolong the QT, macrolides such as azithromycin, the D2 antagonists, metoclopramide, the antipsychotics, TCAs, all right, high yield. But 50S inhibitor, not just azithromycin for chlamydia or mycoplasma pneumonia, but not used in this case, but also chloramphenicol, clindamycin, clindamycin for pulmonary abscess, linezolid, wrong fucking answer. Choice. And then azithromycin causes GI upset. Okay, so upset stomach, diarrhea, constipation. Choice C, dihydrofolate reductase inhibitor, wrong fucking answer. Could refer to methotrexate, pyrimethamine, trimethoprim, but methotrexate's the highest yield one you got to know. Okay, the others not really high yield. Methotrexate, first line DMARD for rheumatoid arthritis, can also be used for psoriatic arthritis if it's the stomach or not responding to topicals. Methotrexate can cause pulmonary fibrosis. It can cause rheumatoid lung. Okay, that's what rheumatoid lungs, idiopathic fibrosis that occurs in rheumatoid arthritis, but the fibrosis due to the methotrexate combined with the rheumatoid arthritis, we just call that presentation rheumatoid lung. But also hepatotoxicity, neutropenia with mouth ulcers from methotrexate, wrong fucking answer. Choice D, RNA synthesis inhibitor, wrong fucking answer. Could refer to rifampin. RDR, rifampin, DNA-dependent RNA polymerase, can cause orange secretions, tears. Obviously, it's used for TB as part of the right management. You can also know ribavirin's an RNA polymerase inhibitor, but more of a low-yield drug. Wrong fucking answer. Choice C, transpeptidase inhibitor. Wrong fucking answer. Transpeptidase is a type of penicillin binding protein. So your beta-lactams, cephalosporins, vancomycin, these are binding to penicillin binding proteins. They knock out gram-positives, okay? There's gram-negative coverage when you introduce the upper generation cephalosporins in particular, but vancomycin hits gram-positives. Okay, penicillin you're going to use for strep pyogenes and also syphilis. Okay, long discussion as far as this stuff's concerned, but Transpeptidase inhibition. It's a penicillin binding protein, and clearly that's for our beta lactams. In this case, wrong fucking answer. You know the deal. I'm to make more content on the Stuff Scrum channel. Appreciate your time. That's it.